Well, good morning, everyone. Happy Donate Life Month, and welcome to Trio Maryland's April Zoom meeting. I'm Marty Marin, and this is my wife, Michelle, and we manage Trio Maryland. We'd like to welcome all our members and guests this morning, and thank you for attending. Today's topic is all about the new CareDx Transplant Pharmacy. You will learn all about it here this morning. On May 9th, we will have our next meeting. It is titled Beyond Skin Deep. It's the truth about skin cancer and organ transplant recipients. Make sure you don't miss it and get ready for the summer. And now I'm going to turn the program over to Michelle to introduce our speaker today.
Today's guest speakers are Hasenia, Nasser-Sidik, Solutions Account Manager at CareDx, plus Jan Edwards, who is the Pharmacy Manager for CareDx. This is a new pharmacy option for your transplant care, so please be prepared with your questions. We're really fortunate to have Hasenia and Jan here to address the Trio Maryland community. We really thank you for presenting to our group. Welcome, and I now turn the program over to you.
Thank you all for joining this Zoom call. It's so nice to meet everyone, and thank you, Michelle and Marty, for all that you do with Trio. We look forward to partnering with you guys in the future. And to the patients, please feel free to ask questions. With CareDx, I'm sure you guys have worked with us through your transplant centers before with some of the AlloSure testing and that sort of thing. I don't know in the group if everybody is from Maryland. If you guys are from another state and you guys are followed with a transplant center outside of Maryland, please put it in the chat. But we're going to talk to you today about a pharmacy solution. We want you to expect a little bit more from your pharmacy. And this is a free pharmacy to use. It's just like using the Walgreens, CVS's of the world. I'm going to pass it to Jan, who's been in the pharmacy field for over 20 years. And that way he can, talk to us about the pharmacy. I will interject in some of the slides to tell you a little bit about what I've seen. My background is I was a transplant coordinator for 15 years working with kidney transplant patients before I joined CareDx a little over 7 years ago. And so I'm very familiar working with patients. I know some of the needs and some of the challenges. And so with the CareDx pharmacy, we know what the challenges are. We've helped overcome them, and we want to, move that along and the benefits along to you. So, Jan, I'm going to pass it to you.
Thank you very much, Hasenia, and thank you, Marty and Michelle. We appreciate the opportunity to speak before Trio today and have a little slide presentation. Feel free to interject your questions at any point, type them into the chat, and Hasenia, you're going to have to feed those to me whenever appropriate, and please add on anything you've got as well. We're going to start with why CareDx may be right for you. I leave that as a very open-ended question because maybe it is, maybe you have a great pharmacy solution right now, and if you do, continue with it, absolutely. But we're going to tell you about how we do it, and you decide whether it's right for you. We have expert pharmacy services for our transplant patients. This is the community that we service, transplant patients. We're going to personalize the medication support and design it to help meet your needs. You're looking at some of our pharmacists on staff. We've got and I just to be personalized because you're gonna find out later on in the presentation why this will matter. We've got Lindsay, Jill, Laura, Chad, Kayla, and Meredith. I'm sorry, Courtney. Meredith is not in the picture, but those are the pharmacists at CareDx Pharmacy. You will meet them throughout the process. You will talk to them. They will be your resource throughout your transplant journey. CareDx, some of you might be familiar with it, is known for its lab testing services that are designed specifically for transplant. CareDx acquired us, CareDx Pharmacy, which at the time we were the transplant pharmacy, which once again just goes to the fact that that's exactly the patient population we service. but CareDx acquired us in 2022. We're now licensed in all 50 states. Michelle actually mentioned earlier, she said, I've never heard of this before. We had been a very regional operation, licensed in 8 states, serviced about 4 transplant centers, and and we have expanded with the support and the commitment from CareDx. So
Jan,
yes.
there's a couple questions. Thank you so much for all that put their questions in the chat. So the first question is that I see on my screen is, I just turned 65 on April 5th, be a belated birthday. What about if I'm on Medicare? Do we accept Medicare?
Yes, we do. And I'll qualify this when we start talking about plans because it's gonna get a little bit complicated. We do coordinate with Medicare Part B, as in Beta. We also do service Medicare D, as in Delta plans. Uh, some plans do have exclusions, and they actually incentivize or direct the patients that participate in those plans to another mail order component. And frankly, when we run benefits checks, verifications, if that is the case, then we're gonna let you know you might be better off financially using the plan or the service through their plan. Uh, so that is one thing.
Very
Also,
good.
some plans have carve outs. Just take a Blue Cross Blue Shield, an Anthem, Cigna, any of those healthcare plans. They have specialized, they will individualize the pharmacy benefit per group. And so sometimes they do carve out a retail provider, but if you're able to get your pharmacy benefit fulfilled at a retail provider, then chances are very likely that you're going to be able to do that with us. And that includes the Medicare D plans as well as the others.
All right, very good. Thank you for putting that. So we do accept Medicare, especially if you have Medicare and a secondary insurance, you should be golden. But the best way to find out for sure is to reach out to Jan, and his contact information will be at the last slide, and he'll do the check for you. He'll let you know. And as he mentioned, we're not just going to take you on as a patient to our pharmacy. We're going to make sure that our pharmacy is the best solution for you and that it's the most cost effective. If you are better off going to a certain pharmacy because your insurance dictates that, we'll let you know because we know that cost is very important. So we'll make sure that our pharmacy is the best option for you and then move you over if that's the case. If it looks like your insurance dictates that you have to go to a certain pharmacy, we'll let you know that as well. So another question. This one is a little bit, more complicated, Jan, at least to me. So I'll ask it to you. It says, this is from Morrison. Thank you, Morrison, for that question. I live in PA, but my transplant center is Johns Hopkins in Baltimore. Does CareDx have everolimus? And if so, what is the price structure? I'm paying $1,000 a month for it after Highmark Blue Cross pays the rest of the $29,000 a month. But that's 1/4 of my take-home pay. That's a lot.
That is
So
a lot.
$1,000 a month. Is there anything that we can do to help this patient? Do we have sometimes, there's that, pharmacy benefit that we have. What can we do for a
Right.
patient like that?
So great question. So yes, we do have everolimus. We are permitted in Pennsylvania as well as the other 49 US states, so we can ship there. We do help patients with finding patient assistance programs. Sometimes there are manufacturer programs that will be eligible. We exhaust as many resources as we can. Uh, this is a very individualized situation, so I encourage you to contact me and we'll work together through the pharmacy to see what is available and what may or may not be. It might very well be that your pharmacy provider right now is currently addressing those issues, but it never hurts to have a second set of eyes on that. Sometimes we're able to find programs that were not otherwise available.
Very good. Do you accept Fed Blue Cross? Where are you located?
Okay. Great question. We currently have two pharmacy locations. One is in Jackson, Mississippi. That's essentially the hub. The other one is right outside of New Orleans, Louisiana. And in the fourth quarter of this year, we'll have a new pharmacy opened. It's been announced in Atlanta, Georgia. Uh, that was part of the plan when CareDx acquired us, is to service regionally, and we've just grown outward from where we were based in Jackson, Mississippi. Uh, so the Federal Blue Cross Blue Shield, again, uh, the group itself, yes, we would be able to uh, accept that plan. Uh, the individual plan within the group, there may be some issues. However, we can do a benefits verification where we can actually look at it and see what is available to us.
All right. That means at the end you contact Jan and he'll do an individualized check for you and let you know. So Morrison, thank you. She thanks you, Jan. And she said, in PA, now it's illegal for insurance providers to force people to use its own mail-in pharmacy. I haven't heard that, but it's a good news, I guess, right?
Well, it is illegal to uh, absolutely to force them to use the plan. However, they incentivize it, and maybe they'll do something, to incentivize, like give a 90-day supply for the 30-day copay. So yes, you're absolutely correct. It is illegal for them to force somebody into a pharmacy situation. However, they can incentivize it. And believe me, they really attempt to do that to capture the long-term care patients.
Wonderful. That is correct. They do incentivize that. So we'll check on that for you and let you know. Ziva, thank you for the comment. Transplant Center, Johns Hopkins, lives in Florida. The good news is for that, if you were to need us for Florida, we do cover Florida as well and can work with the Johns Hopkins team. I think that's good for now. Let's continue to hear what Jan has to say and what makes our pharmacy different, special, and makes you expect more from your pharmacy.
Okay. So we're definitely a specialized pharmacy. Our intent is to care for the complexities of a transplant medicines. We have experienced transplant pharmacists. You saw the picture of them opening the slide deck, and we do focus exclusively on transplant patients. But at this point, I like to emphasize that we can handle the patient's entire prescription profile. So if you are getting a diabetes drug or hypertension, anything like that, we'll also provide that as well. That keeps you with a single pharmacy rather than having a polypharmacy situation where your prescriptions are at multiple pharmacies. Uh, because we service this patient group exclusively, it gives our pharmacist unparalleled knowledge of the transplant medications. Any interactions, anything like that, we're going to be on top of it. Uh, the holistic medication management, uh, again, we're looking at the entire patient profile. We want to know, one of the benefits of us providing all of the medications is if there is an interaction between a diabetic drug and the transplant drug or something like that. Uh, we have one-on-one support, and that's part of the covered benefits that you're going to receive from us. Every patient is paired with what we call a dedicated care team, and it's for personalized guidance. Now, what does a dedicated care team mean? It means we have one pharmacist paired with a certified pharmacy technician. That's going to be your primary point of coverage. Uh, I always use Mandy, who's one of our certified pharmacy technicians, and she's paired up with our pharmacist, Chad Johnson. And we've modeled this after what transplant centers do. You have one coordinator that is primarily responsible for your aftercare management. And we do the same thing with that patient care team. And so when you call up CareDx Pharmacy, you're going to speak with Mandy, or she's going to reach out to you through a text, email, or a phone call and discuss your profile monthly. And if you need the pharmacist support, then she's going to route you to Chad. Uh, I do like to say right here, and it's as good a spot as any, when you call CareDx Pharmacy, the phone is answered by a human. There are no phone trees. Sometimes we do have to put you on hold because maybe Jill or Chad, they're working on another plan at that particular moment. But we might have to put you on hold, but we are going to get to you, and you're going to get routed and directed to, and maybe Jill's on vacation, or Kayla had a sick child that day, so maybe she's not there, but one of our other pharmacists will be familiar with your profile and be able to work with you on that. So you're going to get a dedicated patient care team. The concierge level of support from the individual, and this kind of goes back to, among other things, patient assistance programs. If we need to look at a patient assistance program to help you with financial support, we're going to do that, help you do that research. Also, if you're on travel, maybe you're taking a vacation or visiting a relative, and you need your medications shipped to a different address, we're gonna work with you on that. No additional charge for any of the services we provide. So if the shipping is included, what we accept is the benefit that the pharmacy benefit adjudicates with us. That's the payment we receive. You say, well, how do you do that? Well, we don't have drugstores on every corner like you see some of the big boxes with. Our overhead is basically moved over to shipping and that sort of things. We're going to coordinate the benefits of the patient. With this, sometimes there are Medicare B and Medicare D conflicts. We're going to make sure the right one is charged. Many of y'all have a Medicare D plan on top of your Medicare B. Medicare B paid for the transplant, therefore you're still under the coverage. We're going to make sure the appropriate party is billed for that. Again, I always caveat this statement. We accept most major insurance plans. Absolutely, we accept them. We will accept virtually any plan, but some plans we are excluded from. But I want to emphasize that Medicare and also many states, and again, individually, we would have to look at that individually to see if the state that if you have a Medicaid coverage, the state that you're in, whether we can do that or not, but we will do that. This is very patient-focused adherence is what we're trying to accomplish. Why is adherence important? Well, these immunosuppressants make it possible for you to maintain the health of that organ graft. And so we're going to focus on this. It's the ultimate benefit is to the patient. The clinics will benefit from it, but the patient is the primary example. We can do that through a variety of things. Again, customized daily pill packs. We utilize rapid packing, which is an individual day, date, time, dose packaging. We can do up to 40 plus medications in a single package if that's what you take. And some of them are more complicated patients, maybe a lung transplant patient, something like that. They're on a lot of meds. And we can put all those in a pill pack. And that way, when it's time to take your medication, instead of opening 40 different bottles, you're opening a single pack. And it is day, date, time stamped. So if it's your morning dose, it's stamped like that. We personalize the communications. What does that mean? If you prefer getting text messages, then we'll text you, and it won't be generated from a computer. It will be an individual texting you. If you prefer email communications, we can do that. If it's phone calls that you prefer, we're going to do that. Maybe you prefer to be called at home as opposed to at work, we'll work that out. Most orders are filled and shipped that same day. If the coverage can be verified, we have the medication in stock, then we're going to ship it. We also compound medications on request. Maybe you're having trouble taking tablets or something like that. Some medications can be compounded for as an alternate delivery method, and it comes in a liquid form, something like that. We can do that. Last year, we filled over 250,000 prescriptions. Those were all to transplant patients. We've got over 1,500 prescribers that have utilized us in the past year, and we currently are supporting 45 plus transplant centers. And just because I can't see the chat, Hasenia, if you can, tell me if there are any questions or anything.
Absolutely, Jan. So I did put your contact information on the chat just in case anybody's interested. You guys can save it now. There is a last slide that does have also Jan's information. So there is a question from Ziva, and it says, do you also service family members of the transplant patient?
So yes, we do that because sometimes it does simplify things. And that's whether they're a transplant patient or not. Some people have actually had their family members use our services as well. Not something we typically go out and look for, but it's certainly something we can do. Absolutely.
Very good. And then we also have a question from Rick. Thank you for your question. Does CareDx submit hard copy claims to insurance?
We certainly can do that. Some insurers still require a HICFA 1500 or some other hard copy. So we certainly can do that. That is very atypical. Most everything is electronically adjudicated, but we can do that.
Thank you, Jan. The one other thing I'll just add before, I don't know if you're ready to move on to the next slide or not, but, and this is something that Jan had mentioned, but I always like to reiterate that. So one of the services that CareDx provides is monthly calls to you guys, to the patients. And this is to check up on you, make sure everything is going okay. Make sure you understand what you're taking, how to take it. If you have questions and the pharmacy technician needs to reach out to the pharmacist to ask, to connect you guys, we can do that. That helps. And if there's something that, you haven't been able to get a hold of the coordinator or anything like that, we also have connection with the coordinator. So we can also circle back to the coordinator too, if needed. But for the most part, it is a monthly outbound call to check up on you. That kind of reassurance, that kind of check-ins really builds like a family-like circle. And you get used to the call every month. And, if there's any questions that come up, of course, you can reach out anytime between the calls. But this outbound call that we do is just showing you we care about you, we check up on you. And like I said, some patients will say, unnecessary to call every month, maybe just send us a text. And if anything's going on, we want to let you guys know, we'll answer a text. Or some of them ask for email. But I did want to emphasize the outbound monthly call to kind of check up on you, see how things are going, and kind of be that extra layer of check-in.
Absolutely, Hasenia. And it's great to emphasize that you are going to hear from us. And you also brought up a very good point that I didn't. I talked about the dedicated patient care teams. That's going to be your patient care team dedicated to you, the individual patient. That is also going to be the point of contact from your clinic. So whoever your healthcare provider is, their point of contact is going to be the same as you. That way we get nice, clear channels working continuously. One of the common questions that we get is, what information do I need to start? And Marty and Michelle, I know this is going to be posted on YouTube. Hasenia, also, you can join in as well. Are copies of this presentation going to be available, or is it just going to be on YouTube?
If you send me your PowerPoint deck, we put it on our website under meeting notes and anyone can access it at any time.
Fantastic. Fantastic. Okay. So, what information do we need? Well, it's just like walking into your hometown pharmacy or one of the national chains. Obviously, patient name, social security, a shipping address, contact, or caregiver name. Because in some of these situations, if it's a pediatric patient, there may be a caregiver involved. Uh, Transplant date and discharge name, and also date on the discharge. Those are very important. We always collect that. Sometimes we don't need the transplant date or discharge date, uh, but if it's Medicare B, we're going to have that for billing purposes. Also, diagnosis code is important. We need to know what type of organ was planted. Uh, a good source of all of this, and this line is actually in for the healthcare providers, and that is the demographic or face sheet. Uh, in the healthcare provider's electronic medical record, the demographic face sheet it basically has all of the information we need. Uh, we do need a copy of all insurance cards, front and back, because again, sometimes there's information hidden on the back of those. And and then the e-scripts or fax prescriptions. From this information, what we're going to do is we'll verify the benefits. We'll be able to inform you what copays are, that sort of thing. And with your choice, we can get you started on the plan. But that is the information that's going to be required if I need to back
So
up.
Jan, going back, we have a couple questions.
Yes.
One from a feline. I'm just kidding. Do you provide a 90-day supply that I am allowed?
We can do that. Again, that's going to be part of actually submitting the claim. And again, sometimes they do have exclusions. But generally we can do a 90-day supply if that is something your plan allows.
All right, Brett, there you have it. And then also we have a question from Darren. What about magnesium supplements? I take 20 pills take 20 pills a day. Also, when we get sick, if medicine prescribed by the doctor, this happens to me, conflict with medicine I take from my transplant. Let's see here. You all call the transplant team if necessary to reconcile the conflict and select the medicine that works. I think you might have addressed the latter in terms of seamlessness. So are we going to work with the transplant center? Are we going to reconcile, kind of see what the new drug is, if it's prescribed, to make sure it does not interfere with what they're already on? And then also, I don't know if you're going to, well, I'll let you answer this one first, and then I'll kind of comment another question.
Right, absolutely. So absolutely, we will check for any drug interaction. So if something has been prescribed, we will, if anything comes up, we will be in contact with the healthcare provider and and make that suggestion, make them aware of that. In some cases, they know that a potential interaction is, but it is still the best course of action. But we certainly kind of throw up the flag just to make sure that they understand. You did mention magnesium, which typically is just an over-the-counter product. Uh, and certainly as part of maintaining your prescription profile, we will do over-the-counter drugs. We will do your other disease state, whether it be hypertension, diabetes, etc. We will do any and all of that, but that is something that is available through us, and we do encourage everybody to transfer their entire prescription profile. Some cases, patients will say, "No, I just have difficulty getting my immunosuppressants, but I want to keep everything else local." If that's the case, that's fine. We can do that as well.
All right, very good. Yeah, I think it's good to emphasize that, if you get a new drug from a physician and you want to make sure your transplant team knows, The script could be, sent to us. And then if you wanted, you could even call your technician and just say, hey, can you make sure my transplant team is aware? Our transplant pharmacist is also going to be reviewing this. So when they do reach out to your transplant center, they're already going to have the lens of a transplant pharmacist who is trained in interactions to be able to kind of let them know some information as well. And the one thing I'll mention about the information needed to start with CareDx Pharmacy, I know this may seem like a lot of information, but this is very standard for the transplant center or whoever your referring provider is to share with the pharmacy. So I know like some of you may be looking at this like maybe you don't have a printer, but this is not necessarily information that you need to share with us. This is more kind of for the transplant center or whoever your provider is that writes your scripts. Is that correct, Jan?
That is correct.
Very good. So I just kind of wanted to let the patients know. So go ahead, Jan.
Right.
Thank you.
Okay. Just like to emphasize a few of these things as well. So sometimes it sounds like I'm repeating myself, but over the course of an hour, you're like, did I hear that? Well, I'm going to repeat some of the important points just so you know I did hear that correctly. Your dedicated patient care team is going to work between your healthcare provider that's writing the scripts and you. It will be comprised of a pharmacist as well as a pharmacy technician. They're going to get to know your health history and your medication plan, and it's going to be a seamless coordination with your doctors. Our pharmacists are specialized. This is the patient population that we support: solid organ transplant patients. We will do their related conditions as well, so it's not exclusively on that. And our guidance is going to support the best possible outcomes. That's what we're looking for. The direct access, again, you call the pharmacy, you're going to get an individual answering the phone, not a phone tree or anything like that. And then we'll also flex to whatever communication method channel you prefer: text, email, phone, whatever it is. We're on that. Again, most insurance plans are accepted. However, we need to, again, there are exclusions by plan. When you go to the individual group, they may have different preferences or formulary set up. We will accept that. We will do a benefits verification, no cost. As with the shipping and other items, there is no cost involved. So the question, do you accept my insurance? More than likely we do, but the biggest thing is we will check for you, and then there's no ding against your healthcare plan. It's like, well, why is he trying to get this filled someplace else? There are no problems with it. We will do the benefits verification. High touch pharmacy services. Didn't allude to this earlier, but that's like, you have my cell phone number. I don't necessarily answer it 24 hours, 7 days a week, but I will always return a call. If a text message or a phone message comes up, I will return it. Sometimes I'm in meetings and my phone is not accessible to me, but I will do that. I will walk you through that. I will start off this high touch pharmacy service by making the introductions with the pharmacy, getting the information needed so I can supply to them, and then make the introductions so everything goes smoothly. Coordinating your benefits with your insurer. We're going to do whatever we can. If something comes up as we submit a claim electronically and your plan has an alternative then that is more cost effective to you, we're going to go ahead and let you know. We'll let your healthcare provider know this as well, if it's something that is acceptable to them. When we talk about reducing cost, if a patient assistance program or something like that, some other benefit is available, we're going to let you know. We're not holding that back or hiding it. The personalized daily packaging, the further out you are from transplant, the more stable the dosing becomes. It becomes very level. So the rapid pack might be a solution for you. I've got to tell you, probably less than 2% of our patients utilize the rapid pack, but it is something for them, for people that are having problems getting pills out. Uh, we're going to monitor your refill timing. You're going to get a call 7 days before, or a text or an email, whatever it might be, reminding you. But it's not an automatic fill. So don't think we're out there automatically filling your prescriptions. We're going to make sure that your doses haven't changed, that you're still on the medication that's been prescribed, because those changes have been made, or sometimes are made, and so we're not going to do that. And then same day fill and shipping. As patients establish with us, they don't necessarily use overnight shipping, although there are instances that will come up. But typically, when we do this monitor of the refill timing, uh, it's going to be a few days before you're out. That way, we get the meds to you in time. And here's a point that I do like to, and it's come up because I think we've had somebody from Florida, and I know Pennsylvania, and I know we're talking about Maryland. So hurricanes, blizzards, uh, all of that can affect shipping. Uh, that's something that we monitor within the pharmacy. Um, and if it looks like there might be an issue with, say, a hurricane that would interrupt shipping, because the shipping is not just based on us, it's also on the courier. So if there's something that may be coming up, then we're going to work to accommodate that. Uh, Also, shipping, you get concerns. Maybe in the past you've received stuff, or heck, we receive stuff in the mail all the time where the package looks like it's been chewed up and spit out by the machine. All of our medications are shipped in accordance to manufacturer specifications. So that's temperature control, any and all of that. So if ice packing is required with it, that's something we're going to do. Uh, most commonly our ship days, and we will ship out on a Friday if it's something, if the problem comes up, but most commonly our ship days are Monday through Thursday. That way the package is typically to the patient in a day or two, and you don't have the overage of a weekend where your medications are just sitting in there. But we do that to make sure that we stay in accordance to the manufacturer's specifications.
John, we do have
Y-
a question.
yes.
And I do think it's so special to be able to have everything home delivered. One less, run you have to do to the pharmacy. But Darren has a question regarding shipping. Is a signature required?
So that we're going to set up with you individually. If you live in a place where you feel confident that you can have it left without a signature, then we'll do that. Some people actually, they just feel that the signature is necessary to make sure that it gets in their hands. So that's something we'll individually set up with you. Anything else, Hasina?
No, Jan.
Okay. Uh, we're a trusted partner. Uh, I, I pose the question, is CareDx Pharmacy right for you? Well, that's something you need to decide. Uh, I am going to be available for you if you would like to explore the options. But we are a trusted partner with proven results. 250,000 prescriptions filled in 2025. 45 plus leading transplant centers have referred patients to our pharmacy, and most major insurance accepted, including Medicare and Medicaid, and that is Medicare B and D. Uh, We have a few patient testimonials. I'll leave those up there and just kind of talk about this is David Miller. He lives in Mississippi. If any of y'all have gone to the transplant games, David is the captain of Team Mississippi. And so if you see him at the next transplant games, give him a holler, ask him how he likes his pharmacy. He's been a patient of ours for years. So, but there's David, uh, and it actually says he is bone marrow as well as a liver transplant. Uh, and then this is a pediatric patient of ours, uh, and that's actually his mother's testimonial. Uh, but Liam is a pediatric kidney transplant recipient. Uh, she had Anne had actually come to us and asked us if she could provide a testimonial. So, those are the stories that make us feel good, uh, you know, and that's what we work towards. So, if there's anything we can help you with, please give us a call. Hasena has already put this information in the chat, and it will be available. Michelle and Marty will get this slide presentation to them, and they'll get it posted. But there is my information.
John, we do have a
Again,
question.
okay, yeah.
From Brett. Thank you, Brett, for this question. I too take a large number of medications 3 times a day. Most are prescriptions, some are over the counter. All are under the direction of my doctors. For example, I take fish oil under prescription, then aspirin and vitamin C with over the counter. How is this handled by you? Also, do you send out insulin?
Yes to all of the above. We do ship insulin. Again, that's something that has to be refrigerated, so there are some constraints as to it will have specialized packing. Uh, you mentioned the OTCs. In some instances, we can file the OTCs on your prescription benefit. We will certainly do that. Sometimes it's actually cheaper to get those on what we call a cash price, but we certainly will do that. Uh, most of our patients do end up with some sort of OTC in their prescription profile. So it's it's not a standing order. We're going to make sure you're still taking that supplement, so that would be included when the pharmacy technician that's part of your care team uh, discusses your profile with you on the monthly basis.
All right, and we have another question here. How much extra from Kay? Thank you for your question. How much extra does the pill pack cost?
No additional charge. No additional charge. None of our services. We accept the reimbursement that comes from uh, submitting your drug claim to your plan. So if your drug claim, if you're using one of the national chains, they submit it, you have a $10 copay. That is exactly what the charge is from us, whether it ships out overnight, whether it is in the rapid pack.
Does anybody, I guess this is more of a question to the group. Do you guys all know what a pill pack or rapid pack looks like? Would it be helpful to see what it looks like? Because I don't know if you guys have ever seen like a vitamin pack where they have all those different, that's what this is. So it's really good for patients that are on stable, not really much changing medication. Instead of having to open up 10 or 20 pill bottles, you just rip it open in the morning, the afternoon, and it has exactly what's in there. So it just makes it a little bit easier. This is advisable for patients that you're not changing a lot of your medication. So, if you remember freshly after the transplant, they were constantly changing your medication. You're going up and down on your Prograf and adding this drug. And this is really good for the patients that are on the same drugs. Not much changes. And it is, as Jan said, there's no fee for that. So it's very, very helpful to have. So, but if you guys want to see what it looks like, I can probably pull it up, or if Jan wants to pull it up, I can pull up what it looks like. And I can also show you the med sheet that we send with our medications. So you can kind of see those two aspects. And then if, for example, say that, we're working with you and your blood pressure cuff breaks, or you need a blood pressure cuff, we also could send you a blood pressure cuff. If you need a scale, we can send you a scale. So this is just to make sure that, as you're managing your blood pressure and you're on these medications, you want to make sure you have a working device. So we just think that's very important. And it's something that we do to kind of approach you as holistically as possible. So that's why we're not only taking care of the medication that's related to your transplant, like what they call the immunosuppressant, which is like the Prograf, the Cellcept, the prednisone. We're also want to manage your high blood pressure medications, all your other medications. So under one view, we can see everything, get a better picture of the health to make sure there's no interactions and that sort of thing.
Absolutely. So that was the end of the slide presentation, and we've got it opened up for questions. We like to think of ourselves as the old-time hometown pharmacy. When I was a kid, you'd walk into the pharmacy if you got sick, and I always said my mom never let us get sick, but if we happened to get really sick, you go see the doctor, he'd prescribe something. You'd walk in, and the pharmacist would immediately ask you how old you were and how much you weighed. And he did that because he was going to go back and that dose was going to be customized to you. And so, but that's the level of service that we like to think. That's what we strive. Hopefully we meet up with it, but we want to make your pharmacy experience personalized to you. And we want it to work for you. Because patient care is ultimately our goal. Help you maintain the health of that precious gift of the organ transplant, and we're going to work towards that.
And as you can imagine, Jan, I am still trying to figure out how to get that screen that has the picture of the dose pack. So I am not so tech savvy, I'll tell you that. Let me
This has been great. This is Michelle. You do have one last question. Brett, I just lost the chat.
Uh-oh.
Brett says that his local pharmacy doesn't always have the item in stock, but it becomes a real problem when he has to wait 2 weeks for the pill to come in, but he's only allowed to request the script 1 week in advance. How do you handle that?
Very big issue. We see that quite a bit. We've seen shortages in the supply chain, that sort of thing. We currently, I'm sure there's a few people on this Teams meeting with us that are taking tacrolimus. We currently have enough inventory of tacrolimus to dispense to every single patient we currently have that we've been servicing for 9 months. So we basically handle that on the back end. We make sure that we have the inventory in stock. Occasionally there is going to be something that comes up, maybe an injectable or something like that. But I want to make sure, sometimes my words get a little bit cloudy. Every patient that we currently have, we have enough tacrolimus in inventory at our facility, at our pharmacy, to supply our entire patient base for 9 months with tacrolimus. So, tacrolimus, I don't know if any of y'all remember, in about 2019, it went on shortage. It's a biologic, and it went on, there weren't raw materials to manufacture it, and it went on shortage. We had it. There was one of the transplant facilities we do some work with. They called us up. They were going to send every patient they had. It was about 400 patients. They were going to send because they were within 2 days of being totally out of it. Uh, so this happens. It comes up. I've seen a lot of it. Uh, Hasena was being kind to me, saying I've done this for 20 plus years. Actually, I just started my 30th year with Transplant Pharmacy. So, uh, uh, that's right. Every one of these gray hairs is earned. Uh, but
Well, Jan, you don't have to admit to that, so don't think that you need to. And so that's great. And is that true for all the immunosuppressant drugs that you really keep an additional inventory so you never have a problem?
So what we do on that's a great question. Tacrolimus actually is the highest utilization immunosuppressant. So with some of the other immunos, like if it's an MPA therapy, a Myfortic or a generic, also Cellcept or its generic, uh, th- those drugs, because there are alternatives, they're not as utilized on as high. We keep substantial inventories of them. Uh,
That's great.
not
That's very reassuring. You do have a question from Darren asking about the Rapid Pack. Darren takes pills 6 different times a day. Would that be too many Rapid Packs for you to handle?
No, with Rapid Pack, we can do a lot of things. Say maybe you take insulin. Insulin came up earlier. Well, insulin is obviously not something we can put in the Rapid Pack, but what we can do is we can do a space saver in there that tells you, reminds you. So I don't know, Hasina, have you found the picture?
Yes, I did. I'm sorry, I wasn't able
Okay.
to share it, but I did put it into the chat. I put a picture of our med sheet. So you're going to get like a nice med sheet with the medication that tells you the exact medication and exactly what it looks like. So it's not a generic picture or anything like that. It's the exact picture. So if you're ever having to describe to your coordinator or to your physician what medication, you can see the exact picture. And this is also comes no charge with the medication. You can use this as your checklist if that helps. And also, I included a picture of the Rapid Pack. I'm sorry, I couldn't figure out how to share my screen. I used to love Zoom, and then all of a sudden we started using Teams, and I forgot how to use Zoom. Otherwise, I used to like when we first transitioned, it was very hard. But I seem to get used to something and then I forget how to do the other stuff. So my apologies. But it is in the chat. There you have it. And
Right.
also, Jan,
But Darren, I definitely wanted to address your specific question. We can do if you took medication 12 different times a day, we can certainly do that. So it's very flexible. We can program in whatever we need on it. So up to 40 medications and a single dose. Well, and it's actually just over 40, but that's kind of the mark that we hit on it. 40 medications and a single dose, as many doses as you have, and each one would be labeled with the day, Tuesday, or well, here, let me do today, Saturday, uh, April 13th. Is that right? No, April 11th. Saturday, April 11th, uh, 11:55 or your noon dose. So we can do, if you had 12 different dosing times, we can do that.
So Jan, this is more of a general question. So we've had like I think up to like maybe 28 or 27 patients on the call today. So if somebody was interested in, trying the pharmacy, working with our pharmacy, I know there was one comment that said they had used our pharmacy, then for some reason somehow it got switched to like a local pharmacy, and so I guess to the patients, how would you guide them? Like how to start this process. Should they
Right,
go straight to their nephrologist or, cardiologist or what's the steps that should be taken to, or should they reach
right,
out to you first to do some, talking and then do that? Kind of guide them how to
right.
start this process.
The best thing is to reach out to me. Uh, we're going to get that information. We'll see what we'll do is we'll run test claims based on your coverage benefits. We will run test claims, and then at that point, then we would contact the healthcare provider and get actual prescriptions.
All right, awesome. So I guess it's good to at least first make sure, yes, we're
Yeah,
the best pharmacy, insurance wise, and we would accept, the insurance and that
right.
sort of thing before you go and ask. And then, would the patient eventually have to reach out to the coordinator, or do we do some of that for them?
No,
How does that work?
we will make that request from we'll get your healthcare provider information and we will reach out to them for a refill request. Sometimes they respond a little bit better to us, sometimes they respond better to the patients.
Okay. All right.
E-scribing has changed the game. They don't mind interacting with pharmacies uh, because they can do it very quickly.
Okay, we have one more question. It says, thank you for this wonderful presentation. You are welcome, Darren. You all take Express Scripts, question mark. I have Blue Cross, but Insurance Express.
Right. Again, more than likely, we have several Express Scripts patients within a Blue Cross Blue Shield plan. Uh, some plans individually do different things with carve outs. And so the best thing to do is we can give it a try and we can do the verification.
All right, very good. So I guess the first step, you guys reach out to Jan. You can text him or call him,
Right.
and start the conversation, and then we can go from there. And he'll kind of help guide you through the process. I know in the last slide it did have his contact information, but I also put it in the chat. So please feel free to try it, and we look forward to servicing you. Thank you guys all for your time. Thank you,
Absolutely.
Michelle and Marty, again for helping
Yes.
set this up. We're always here for the patients and the transplant centers and society as a whole.